lovers, my name is Dr. Lopez. We're going to be doing a reaction video to the Rocky Mountain vet. I'm really interested to see what's going on here, so.
Okay, but this looks like it's dying.
Wow, his paw looks really bad. It looks necrotic.
Just know what happened sometime yesterday. We were trying to, take care of it ourselves.
They've obviously left this too long.
I've seen swelling like this on bite, but this looks like it's dying.
The technician's face, they don't like seeing this kind of thing. Animals suffering. This is hard to watch, to be honest.
We took him to the vet near us. They wanted to charge us $2,000 or more, and we're not rich,
The bottle of anti-venom can cost $1,000. Some dogs might need more. These owners were obviously unprepared for the financial reality of medical care, and they can't afford it. This comes as a huge shock to them. It's very common for pet owners to blame the veterinarians for the cost of medical care. Most vets don't have control over the cost of medical care. And even practice owners, you can only absorb so much of your client's medical costs. I know personally, I still have a $10,000 credit card bill on my own personal credit card from our client that never paid me back. So you can't be paying everybody's medical bills. We have our own bills to pay. We have the hospital overhead. We have our student loans, hundreds of thousands of dollars of student loans. For pet owners to come in on emergency and expect their vet to pay their bill is unfair. The vet team. At the end of the day, that's the owner's responsibility. As veterinarians, that's the biggest problem we encounter, is that a lot of pet owners are not prepared for the financial reality of medical care. Nobody ever told them. They don't learn until they're in that situation. They're already in the emergency. They're emotional. They don't have the money. I am sad for these owners that they didn't know about this, that they weren't prepared for it. Poor baby.
He's only 3 years old.
He's only 3.
He's still young. That's why we had to bring him here, because we don't want him to die.
Some of you might not know this, but I grew up in New Mexico. That area actually has some of the more dangerous rattlesnakes. And a bite from a prairie rattlesnake can be very quickly fatal. When I was working as a vet in Taos, we saw quite a few rattlesnake bites. I personally have come into contact with rattlesnakes twice. There's nothing like the sound of a rattlesnake. It is like this alarm bell in your soul.
Beautiful, beautiful western diamondback rattlesnake.
That's part of their own defense mechanism, and it's to help protect you too. So I think rattlesnakes are beautiful creatures. Really, they're out there to be eating rodents. They're not our enemy. There's no reason to be out there killing rattlesnakes. We can't blame the rattlesnakes. They're wild animals in their own environment, and they give you a pretty big warning. And so you have to actually cross that line and continue to antagonize them in order to get bit, which a lot of times dogs do.
Western diamondback rattlesnake, it looks like he just bit him up like camera.
Dogs will be running after bears, and they'll be running after coyotes, and porcupine quills is a perfect example of that. If you've ever seen a porcupine, they're so docile and so gentle and so slow moving that for dogs to be coming in with porcupine quills in their face, it really means that they were antagonizing that wild animal. The take-home point is always prevention. What can you do to prevent an emergency? Most injuries resulting from conflicts with wildlife are preventable. And if you are in a wildlife area, dogs are like toddlers. They just don't understand the dangers. You should keep your pet under close supervision or on leash to protect them from dangers like getting bitten by rattlesnakes or getting quilled by porcupines or bitten by bears. Okay, let's continue watching. Poor little guy's in a lot of pain. The blood in the syringe that she's holding is very dark. It looks black, and that's not normal. That's not a good sign. This patient is very sick. It looks like they've drawn a line on his limb to mark how far the necrosis is and to make sure it's not spreading.
We're doing some IV fluids, and we'll get some antibiotics obviously on board, but we don't have any anti-serum here. It's expensive.
For those people wondering why a vial of anti-venom can be so expensive, to make anti-venom, it's a very involved process. Small amounts of venom from all of these different rattlesnakes are administered to horses and donkeys. And then the scientists collect their blood and isolate the antibodies animals have formed to the venom. So that's why it's so expensive. These animals in the laboratory, their sole purpose of existence is to make antibodies to the venom so that it can be harvested into a serum. For all of the times that you absorb the medical costs, that you don't charge for your time, that you just try to help people, at the end of the day, profitability of the clinic. At this clinic, they can't afford to stock the anti-venom. A lot of people have very unrealistic expectations of vets, and it can be draining. It leads to a lot of burnout. When you have a revolving door of people coming in, not able to afford their medical bills, and then basically blaming that on you, you're just trying to do your job. You're trying to help these patients. It definitely takes its toll. I'm noticing if you look at the faces of these dedicated technicians and this dedicated doctor, you can tell that they're tired.
The thing is, because they're out past 24 hours for the anti-venom, it's not going to make much difference.
Okay, so he's coming out to talk to the family now.
Okay, well, don't get a lot of snake bites. In fact, I've never seen one like this before.
And you can just see the expression on his face. You know, nobody likes to see an animal suffer like this, especially a veterinarian. Dr. Jeff, he's going to do his best with the situation that was presented to him. There's a lot of times where pets are just brought in too late. They don't get medical care in time. People sit and watch, try to manage it on their own until it's so bad that the patient's almost dying, and then they bring it in at the very last minute and they don't have any money to put towards the bill. And you know, this is really common. You know, it's the worst part of our job, having to see these patients suffer or even die, feeling that you could have helped them if only they had been brought in sooner.
It would have been great to get anti-venom in them sooner. We're over 24 hours.
It's kind of a nice way of saying, you guys waited way too long to bring this dog in. If you have a toddler that gets bitten by a rattlesnake and you wait until the next day when the leg is necrotic and falling off, and you take them to the hospital and then you decline treatment due to cost, you will have social services and child protection all over you if you do something like that with a kid. Well, dogs are like toddlers, and they also depend upon their parents for medical care. Failing to provide medical care in an emergency until it's this bad, that is neglect. And neglect is a form of animal abuse. I would have major reservations about returning this dog to its owners if they're unable to A, keep it safe, and B, provide it medical care if something serious happens.
Odds are, I don't know if it make that much difference at this point. We're treating the symptoms of what's going on. That's all we can do, is wait and see.
That's the case with all antidotes. You want to get them in as soon as possible. At this point, the damage is already done. We kind of missed our window of opportunity. That was yesterday, and now our only option here is damage control. And in the meantime, this dog could lose his leg. The reason for not seeking veterinary care at the beginning was cost. Well, now, keeping a patient like this in the hospital for several days, the surgery that will be needed, that costs a lot more than a couple of vials of anti-venom and some IV fluids. I'm guessing would be many thousands. In waiting, not only have they caused this dog to suffer, but the expense is also a lot higher.
All right, thank you. I'm sorry. All right.
And he's compassionate. He's trying to say, you know what, it's not your fault. You didn't know. This is obviously a vet that has his heart in the right place and goes above and beyond, sacrificing a lot and enduring a lot to help people's pets when they really kind of got themselves into these situations. So if that's the one thing that I could change in the profession, it would be more awareness and preparedness, prevention, a better job of educating people on how to be better pet owners so that families and the pets and the veterinary teams don't have to be put in these situations over and over again.
So what tissue losing out of that?
Unfortunately, Rocky got bit by a rattlesnake. It's swollen. The idea is to cut the leg and relieve some of that pressure.
Okay, Rock, it's okay.
The ideal outcome would be to save Rocky's leg and Rocky's life. But at this point, we don't know if we can do either.
Planned pethood. Exactly. That's exactly what I'm saying. We need more planned pethood. People prepared for pet ownership. Ready. Pethood.
It's just too much pressure. That took some of the pressure. Just so the incision stays clean. The damage has kind of been done.
They're sad. Poor technician. And they see so much of it, you just become desensitized. You can see she's just trying to keep a straight face. But behind that is a lot of sadness, a lot of frustration. And honestly, probably anger too. I mean, these are innocent babies that are coming in, and their families, you know, are not taking care of them in the way that we as doctors would like to see them cared for. So it's hard to see cases of medical neglect. And being poor, not having enough money, is that a good enough excuse for neglect? Is it an excuse for abuse? Not knowing, not being prepared, is that a good enough excuse for neglect? Let me know what you think in the comments, but... Oh, they just love him.
Come on, Pumpkin. Alright,
Yeah, so you can see how much the technicians, the nurses, and the assistants, they just love these animals. They're there for the animals. It's really hard for them to see this type of suffering.
We're 72 hours in on this, so if the bottom of his foot is all dead, then we're probably going to end up amputating his leg.
the big reveal.
Yeah, so he might lose his leg, but we'll see what happens.
Foot's a lot smaller. That's pretty amazing. I mean, that's kind of healthy looking granulation tissue. I mean, I think the swelling's going to keep going down.
Looks like they got lucky here and things are improving.
It's been 4 days.
That's beautiful. And I can definitely close it and have a totally normal, functional leg.
Dr. Jeff looks happy, relieved.
I mean, he very well could have died. I take credit for this, but this was Rocky more than me. He's a tough dog.
Such a nice vet. So humble too, right?
At that, I think the owners are going to be pleased with it. That's the main thing.
Yeah, that's the main thing. A lot of times you go above and beyond and do heroics for an owner and they're still ungrateful and angry and think you're a greedy bastard. So having owners that are appreciative always goes a long way.
That's it. A few more weeks and that'll be totally healed.
And meanwhile, he'll just get back to his whole room of dogs in emergency situations that have probably been neglected. Okay, well that's that. That video was really hard to watch. I feel sad for this dog, for the family, for Dr. Jeff, and for his staff, for all the other emergency vets that they have to see this kind of thing day after day. Sometimes with not a lot of options other than euthanasia. So that's a day in the life of, you know, you see a lot of that. There are 3 pieces of advice I have. And one is don't wait too long, which means this patient should have been seen yesterday. If he had been seen yesterday and he'd gotten the medical care that he needed, he would not have a necrotic limb. He would not have suffered. It wouldn't be this bad. Number 2 is prevent the preventable. So you truly can prevent most emergencies resulting from wildlife encounters. They depend upon their parents to keep them safe. If you keep your pet under close supervision, you protect them from danger, you can avoid these situations altogether. And 3rd is be prepared for the worst case scenario. And that means be financially prepared. And that is a huge one. So if something serious happens, you don't have to make life or death decisions based on cost. So that was my first reaction video. If you have any other questions or comments, please, we'd love to hear them in the comments below. Dr. Jeff, Rocky Mountain Vet, and all the staff there, you guys keep up the great work. You're doing a really good thing. God bless you all. Thank you for joining us and take care.